Well, Irshad Ali Shaikh is the health security lead and interim head of the WHO in Turkey. He joins me now from Ankara with more on the impact of the coronavirus on the African continent. Thanks for being with us. You know, Africa is arguably the continent least equipped to deal with this pandemic, given the state of the health infrastructure in many countries. But Uganda, I mean, as we saw there, has done a pretty admirable job. Do you think that could better be scaled across the continent to get the spread under control?
Thank you and good afternoon. First and foremost, I'm putting the mask on because WHO, our Director General and Regional Director in Copenhagen, we have started the Global Mask Challenge. So we challenge everyone to put the mask on, keep yourself, your loved ones, your family members, your neighborhood, your community, your country safe. Coming back to your question of Africa, I think one thing we also need to understand that for Africa, outbreaks, unfortunately, are a daily business. So the public health authorities and the community are tuned to outbreaks of acute watery diarrhea, cholera, sometimes pneumonia, respiratory infections, gastrointestinal infections. So the culture and mindset of those countries is different. So their readiness is much better by default as contrasted to other countries where we do not see outbreaks. Yes, Ugandan experience is unique, and based on the numbers reported, it can be put up to scale, but again, it is the community which needs to follow, putting the mask on, physical distancing, hand washing, but other factors that are not common in advanced countries is the access to safe water to wash your hands, and then capacity to social or physical distance because of population density, like your reporter said, and many people living under one roof, or having the assets to go and quarantine and isolate yourself in a separate place. But despite those limitations, we think Uganda has done remarkably well, and credit needs to go to the authorities, to the community. And yes, there's a lesson for whole Africa, or the whole world in it.
Right. You know, as you're saying that people need to keep, or if, at least start wearing masks and keep wearing them if we're seeing them, because we have seen a certain level of complacency in some countries that think they have seen the peak. You've seen masks come off in certain areas. People have less and less social distancing taking place. And there also seems to be a little too much reliance on the so-called good news we've had about the development of a potential vaccine. How much does that worry you? Are you confident, first of all, about these reports about the vaccine development in countries like Russia, for example, that just thinks it's months away? Or are you scared that people will get complacent based on those reports and drop their guard?
So I think two questions there, and very logical and very insightful questions. Thank you. First question, that do we have faith? I think we need to appreciate that the public health and research community across the globe, under the auspices of agencies like WHO and other countries, have come together, and what would normally take for a vaccine 3-4 years, even more, is now happening in months. Without cutting corners, that is the most important thing to understand. Without cutting corners, the technology and the collaboration and coordination is bringing the world together to fast track from preclinical to phase 1 to phase 2 to phase 3, with some phases happening simultaneously. So that is one. And yes, we are cautiously optimistic that the vaccine, there are about 6 vaccines which are undergoing phase 3, which is the largest scale trial in thousands to look at vaccines effectiveness in every age group and every ethnicity. So those are coming out in Australia, Germany, UK, Brazil, United Arab Emirates. So many countries are coming together, and we hope to have relatively effective vaccine by early next year. That is the hope. On the other flip side, yes, it has introduced some level of complacency. What we need to understand is the virus and numbers were down because there were lockdowns. Now, when you will remove lockdowns, numbers will go up. And while we are out of lockdowns, we do not have a vaccine. We do not have an effective treatment. So the only treatment still available is either we go back to lockdowns, or we show responsibility and wear our masks, keep physical distance, stay home when we are sick, wash our hands, sanitation and hygiene, and show good etiquettes in terms of sanitation and hygiene when we cough or sneeze. So those are the only treatment and vaccine. So lockdown is relaxations is a luxury that authorities are affording us because of livelihoods. People need to come back.
Right.
Economy needs to open. School needs to open. These are incidents of normalcy of life. So normal life has to come back, not just for physical health, but mental health.
Right.
Plus, because of COVID, there are many things that people stop. People stop going to hospitals for coronary artery disease, stop going for management of diabetes, hypertension, complicated pregnancy, cancer early diagnosis. All those things were relatively put on hold. Those things need to come back, but we all need to play our role.
Right. Irshad Ali Shaikh, we will have to leave it there. Thank you so much for being with us and sharing your insight. We appreciate it.